Invisalign is an amazing option for straightening teeth, but let's be real, there are some problems that come with it. If you or someone you know has Invisalign, you've probably dealt with one or more of these issues. Today, I'll show you exactly how to fix 4 of them. Now first, before we get started, as a favor for me, your favorite orthodontist on YouTube, if you don't mind, hit that like button to support us for the YouTube algorithm and hit that subscribe button so you can stay up to date with all the new videos that we come out with to help you get that stellar smile. In case you're new here, I'm Dr. J and I've been helping kids and parents like you for over 25 years. I'm passionate about fixing teeth because I know a beautiful, functional smile is so much more than looking good. It affects a person's entire life. I love helping people because it's directly tied to my faith in Jesus Christ. Go ahead and comment below your favorite Bible verse. Now, let's get into it. I get asked this a lot every day. How many times a day should I brush? I ask back, how many times a day do you eat? 2. All right, what about snacks? Oh, another 3. So 2 plus 3 gives us 5.
2 plus 2 is 4, minus 1, that's 3, quick maths.
Do I need to brush after this? Of course! Just like these M&Ms, food particles can get trapped in your aligners and attract all this kind of bacteria, and they lead to all kinds of dental issues, such as cavities and gingivitis, which is a type of gum disease. If you spill food on the table during a meal, you clean it up right after. Teeth are the same. You don't want food stuck to the surface or the table of your mouth. Here's how your aligners will look with plaque in them, and just imagine all of this is pushed up against your teeth and your gums. Yuck.
Oh! Ew!
I've heard this before. My son can't brush his teeth in school. Let me help you with that. This travel toothbrush folds and fits right in your pocket. Super compact. You can even get travel toothpaste. But if you have no toothpaste, then plain water will do. And if your child does not want to use the bathroom, then go to the nurse's office, brush your teeth, put in your aligners, and you're done. Cavities, as you know, will cause you pain, money, and lost time in Invisalign treatment. A few times a month, I get a call that the aligner is cutting the tongue. If you watch my other videos, you know that Invisalign aligners are precision cut by robot and form-fitting to the teeth. Now, the cutting of the tongue is almost always caused by the child flicking the aligner with their tongue and chewing on it. This flattens it out, making it really sharp. Let me demonstrate for you. So I'm going to simulate with my finger. This is the lower aligner. So if they're going to flick, they're usually going to flick here and they keep on doing it. And once they flick it, as you see, it's no longer form-fitting to the tooth. And then they bite down on it. And then they flick it up and bite down, flick it up and bite down. And what happens, this flattens it over time. And I'll show you a demo. And here's a demo of an aligner that's been flicked and chewed. If you see on this side, you see how it's wider and flattened and the ridges are gone? And I'm going to rotate this. You see how thin it is compared to the other side, which is the correct. Once it's flat, you see right here, that's the edge that digs into the tongue. So what's the best way to fix this? Encourage your child to avoid playing with the aligners altogether. If the aligner does get distorted, trim it as shown before, or throw it away and move forward to the next aligner. If the child had only had that aligner even for a couple of days, then move to the next new aligner and wear that for 1 or 2 weeks. What happens is once it doesn't fit, it's not doing its job. And if it's cutting the tongue, definitely get rid of it.
Bye, Felicia.
Before we jump into the next problem, if you're a parent considering Invisalign first for your child, I'll put together a free comparison guide to help you decide. It covers everything you need to know about traditional methods versus Invisalign first, so check the link in the description below for your free guide. If you've had Invisalign for less than a week or so, you might have noticed more saliva than usual. This happens because your mouth isn't used to having something in it, so it thinks the aligners are food, and your body reacts by producing extra saliva to wash it away. Thankfully, your mouth adapts quickly, and for most people, this only lasts a week or 2 before things get back to normal. Now, problem number 1, the lisp. When you get your aligners, the mouth isn't used to the new material's thickness, so that causes a lisp. But don't worry, The tongue is a muscle and it's able to adapt. I always encourage my patients to talk a lot. And if you're not the talkative type, then watch your favorite TV show and repeat aloud everything they say, or sing your favorite song. Most people find that their lisp goes away fairly soon after starting treatment, usually a matter of days. But what if you lose your Invisalign aligners? This is the #1 question I get, and I talk about each scenario and exactly what to do in this video right here. If you want to know which is better for your kids, Invisalign or braces, I made a video about that right here. Pray to God every day and ask Him, Lord, bless me to be a blessing to someone else. Does not have to be someone you know. How cool is it when someone says to you, you made my day, and then you smile and point up? He did.